Hello and welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you, but help you to move on to the bright side of it. I am your host, physiotherapist Meghna Dave, and today let's understand what is Parkinson's disease and how it can be managed or can be helped with the help of physiotherapy. This video would be specially helpful for someone who is suffering from Parkinson's disease or for someone who is taking care of a person or individual who is suffering from Parkinson's disease. This video will give you an understanding of why you should take physiotherapy very seriously when it comes to management of Parkinson's disease. So make sure to stay tuned till the end. Let's begin. So friends, Parkinson's disease is a neurodegenerative disorder. When I say neurodegenerative disorders, I mean that in condition in which there is a constant degeneration or as aging impact happening on the central nervous system or as you can say brain. Now, due to this neurodegenerative disorder, what is going to happen is an individual's ability to do the functional task of day-to-day life, which is controlled by your brain, starts getting impacted. That's why an individual suffering from Parkinson's disease have symptoms related to their movements, have symptoms related to their ability of understanding or cognition. They have symptoms or problem in communication. At the same time, they have symptoms and problem in doing some fine activities with the help of hand. The reason being very simple, that the brain is slowly degenerating. Unfortunately, this is not an incurable problem, and that's why it is one of the leading cause of death when it comes to neurodegenerative disorders. This problem can affect any individual beyond 60 years of age and is more commonly seen in individuals who have got a lot of stress-related lifestyle lived in the earlier days of life. Because the stress levels in the body are more, and studies have shown that stress is one of the predictive factors for Parkinson's disease in future days. So, how do one manages Parkinson's disease? For understanding that, we should also first understand what are the problems that will happen that will affect the quality of life of an individual suffering from Parkinson's disease. So let's break down into three parts. Number one is the problem in the structure of the body itself, which is called as the degenerative changes that's happening in the brain. Now, I will not go very much into the clinical detail because it will get very technical, but to make it very simple for you to understand, the brain cells that are present, they start showing some degenerative changes. But let's see in more detail what are the functional challenges or impairments that an individual can experience. Let's start with movements. So, slowness of movement, rigidity. What is rigidity? Rigidity is that when an individual is moving the hand, they feel that there is some rigidness. It's not able to freely move. There's some sort of tension or traction that is being constantly felt by an individual. There will be slowness of the movement, which is also called as bradykinesia in medical terms. There will be tremors. What do we mean by tremors? Simple, right? We must have seen a lot of people complaining on that. Well, these tremors are very predominantly seen in an individual who is suffering from Parkinson's disease. That's not all. The patient suffering from Parkinson's disease will also experience a lot of balancing challenges. Falls are one of the frequent emergencies, or you can say casualties, that happen when a patient is suffering from Parkinson's disease. So this was related to movements. When it comes to cognition, the face becomes masked. They start losing expression. They start losing ability to communicate. And that impacts their ability of living a normal lifestyle. This communication difficulty also goes further where they start experiencing dysphagia, which means that they are not able to speak well. There will be slurring of speech that slowly develops. That makes it further difficult for the patient. And that's not all. When it comes to cognition or as the ability to understand things, that's where also they start facing challenges. There is difficulty in understanding concepts. There's difficulty in communicating those concepts. There are also sleep disorders. Their ability to concentrate or focus on one thing reduces. That overall affects the quality of life of an individual, which makes an individual disabled. Their ability to continue their vocation or their jobs gets difficult. Their ability to do day-to-day home chores gets difficult. Their ability to travel or transport somewhere also gets difficult. And as the age begins, these secondary complication gives rise to some other complication and makes the individual's life difficult. So that's why the treatment of this problem and the early diagnosis is very important. The sooner it is diagnosed, the better are the chances not to reverse it, but at least to maintain it to a certain extent that that individual can live a better quality of life. So, what's the treatment that's involved in Parkinson's disease management? Well, unfortunately, there are no studies which have shown that there's any medical management that do exist that completely cures this problem, which means Parkinson's disease is a non-curable problem. However, medicines like levodopa is one of the commonest medicine and most proven medicine that is being used from years for the management of Parkinson's disease. This medicine has to be continued for a very long period of time. And this management has to be then aided up with the help of physiotherapy. Not only physiotherapy, there might be the need of occupational therapist, at the same time speech therapist, or sometimes an orthotic individual to help this individual to attain the maximum quality of life as possible. Now let's dive a bit more deeper into and understand what's the role of physiotherapy. Now, physiotherapist basically focuses on one key goal, and that is to improve the functional mobility of an individual and improve the quality of life. And for that, all the motor impairments, what we call it as the movements that are affected or are challenged, we need to identify them and we need to solve them. So, what does a usual plan looks like of physiotherapist when he or she works with a patient? So, the first focus is on the tone of the muscle. When I said that there could be rigidity in the muscle or the muscles can be more tight than usual, that's where physiotherapists work on relaxing those muscles using techniques like stretching exercises, myofascial releases, joint compression, etc. Similarly, patient has to practice this along with their caregivers many times in a day so that more repetition allows more relaxation. Same way, physiotherapist also focuses on teaching breathing exercises to the patient in order to maintain good functional activity of the lungs. Yes, lung function is very important to maintain the endurance, to maintain the oxygenation of the blood, and at the same time also maintain good airways and prevent chances of infection. And that's why the role of physiotherapist also comes in introducing breathing exercises to the patient. That's not all. Physiotherapist also focuses on reducing the tremor and also to maintain good speed and mobility of the muscle with the help of progressive exercises. So, exercise regime basically focuses on flexibility exercises, mobility exercises, strengthening exercises, balance training exercises, weight shifting exercises to name few. When a strategic treatment plan is made and when goal-based treatment protocols are created, that's where a patient can see some significant changes in their lifestyle. They can see that they are able to maintain a good quality of life. And they can also somewhere experience that even though they are not able to reverse the condition, but they are able to at least prevent the progression of the condition. And that's where is the role of physiotherapist that comes into the picture. Neurorehabilitation physiotherapists are a specialized physiotherapists who are trained in managing these conditions like Parkinson's disease. Neurorehab physiotherapists do their masters in neurorehabilitation and study very deeply the function of central nervous system and all the pathologies that are related to central nervous system that leads to movement impairments. You can find these neuro rehab physiotherapists in hospital setups, in physiotherapy units, and at HealthQ Rehab as well. So, if you or someone in your network or in your connection is suffering from Parkinson's disease, make sure to share this video with them just to get a fair idea why do they need physiotherapy. Because if all of these things are not taken, what is going to happen? The rigidity is going to increase. That will make an individual's ability to even transfer in the bed difficult. Their ability to communicate will get affected. Since facial movements are not working properly, their facial expressions will also get impacted. So their ability to communicate will get impacted. Brain functions will start getting impacted. that needs to be addressed. Even the lung muscles will not be that adequate. That will impact their ability to endure tasks, their ability to move around, to transport, to travel. All of this will start affecting. And if this all things has to be prevented, then physiotherapy is the answer to that solution. Physiotherapy, along with other therapists, when combined and work as a team, then only a better outcome can be achieved. So I hope through this video, I was able to, in a very short way, explain you what is the role of physiotherapy when it comes to Parkinson's disease. If yes, make sure to like this video, share this video to someone who needs it, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.